Today. I think we're still waiting for one of our panelists to get logged in here, but um, uh, Suzan Hurlbut is kind of pulling double duty this morning as helping to both moderate and serve on our panel today. But today, with the embracing these texts from Luke, a story of healing of the centurion's slave, and a story of resurrection, a story of deep grief that turns into deep joy for a widow whose future gets restored because Jesus heals her, brings back to life her son. It was a great opportunity for us to sort of visit and revisit the status of healing in our world this day. The COVID-19 pandemic continues to shape almost every aspect of our life, and we've had some remarkable journeys that we've all gone on this last year. Can you believe it? Think what you were doing a year ago, right? And what life was like, and what you were starting to learn about COVID-19, and what you imagined the impact of that might be on your life, if at all, and compare that with where we sit today. And we have with us in our panel today, we have a variety of voices who have represent a bit of a spectrum of experience around hands-on response to this pandemic. And so we thought it would be a great chance to sort of check in and see how things are going, what's been surprising, and what has been a source of hope, what continues to be a source of deep challenge and concern, and some of those experiences. And so we had, let's see here. We have asked a number of people to serve on our panel today, and so let's just start with introductions and go around and just describe a little bit about your experience, kind of what frame for us your connecting points in with the type of healthcare setting, if that's the right word, that you're working within, and how you've experienced the last year, and then we'll do some more questions later on, getting into some specifics. But just sort of give us a general sense of your context, who you are, and we'll take it from there. And just because you're on the screen right next to mine, Char, I'm going to call on you first, Char Ulstad-Warkentien, and have you introduce yourself and your vocational identity. Go for it. Go for it.
Super. I will try to make this brief. I'm Char Ulstad, for those who don't know me. I work at what was Health East and now rebranded as M Health Fairview Rice Street Clinic. I have spent my entire medical career there since training. So I am about 28 years into that. I am a family medicine physician, and our clinic, if any of you know anything about our location, is a really interesting sort of multicultural experience. I like to say we see the homeless to the CEOs on a daily basis. We have about 40 to 50% of our visits are interpreted visits. We see a great deal of the immigrant population. Our clinic deals mostly, our largest immigrant population is still the Hmong families, but being quickly sort of equaled by the Karen population, the Burmese refugees, and the Somali refugees. So we see a wide panel of patients, and doing family medicine, we see it all. And we deal with COVID and these sorts of things on a daily basis. And I guess I will stop by saying it is an ever-changing landscape on a daily basis.
Thanks, Char. I'm responding to Suzan has put just a note out about Zoom this morning, and as Char was talking, I just Googled quick. I'm not seeing any information about some problem with Zoom today. Suzan, do you have some more information you want to share with us?
That was Michael who did that about the Zoom alert. If you're connected to this meeting through a web browser, Zoom client is okay, disconnect. Some kind of a nation state is launching an attack through web browsers, it says. So I'm not quite sure what that's on, so.
This is Laurel. I had a hard time getting on, so I had to get on my computer instead of phone.
Oh.
Okay.
Okay. Yeah, so difficult. I mean, I guess if we're connected, it's maybe, I think we're okay. And most people who are using a laptop device or a tablet would be connecting through
Zoom.
the client, and then a phone would be a similar. You'd be through the Zoom app, and so I'm not quite sure how you'd work it through a browser. But okay.
Okay.
Well, let's continue. Thank you, Char. Great to have you here with us today. Let's see. Let us call on Esther Tatley and have Esther introduce herself and talk a little bit about your connecting point here this morning.
Thank you. Am I on as far as voice? Oh, good. Excuse me. I haven't talked much this morning, so I'm a little gravelly, but I am a retired public health nurse, essentially. I spent a part of that time as an administrator, et cetera, but nevertheless, public health is my graduate degree and my initial Bachelor's of Science in Nursing I obtained from St. Olaf College way back in the day. They're still producing nurses, however, which is a good thing. And I fell in love with public health way early in my career, and have really wanted to be with it ever since. It's had lots of meaning for me to be working in the community with other organizations that also produce good resources for people, and people don't always know that. And so as we go, we not only work with individuals, we work with communities, and then we are a resource source for many, because that's our job. We are in the business of working with at-risk populations particularly, and we are always carrying the weight of prevention in our language. So that's what we are. I'm rather interested in now seeing public health make the headlines as much as it has, thankfully. And I can only hope and maybe pray a little that public health will finally be funded decently. Who knows? Maybe not. Underfunded it has been always. So that's been part of the interesting struggle of providing public health services in a county or in a school district. School nurses are public health nurses, etc. So, and I've done both, luckily. I've had a wonderful career, fabulous. So thanks for asking me. I'm enjoying being here. It's great.
You're muted, Pete. There you go.
Thanks, Esther. And now we'll invite Dr. Laurel Cederberg to chime in.
Hi, guys. I came in just so you see my daily look. Now these days I'm wearing my Bambalagombe scrubs. I wear scrubs every day. I've got my protective glasses. I've got my hair. I've got my mask every day.
Yeah.
So I'm a pediatrician at Health Partners Como Clinic. I've been there 24 years, and part of pediatrics, or a great part of pediatrics, is prevention, just like Esther says. So we are like this with public health, as Char is as well in prevention. That's a big part. So I'm happy to be here. So I see patients from birth at Regions. I round at Regions Hospital, see the newborns, and I see patients at the Health Partners Como Clinic. And we see a great diverse population there. And I see kids till about 19.
Great. Thank you. We're so glad to have you join us today, Laurel. And lastly, Suzan, we're going to hear from you. And then if you want to get us started with the first round of questioning.
Great, I will do that. Yeah, I got a little off track at the beginning because of that security alert, but I was gonna start to say that, you know, that we decided to talk about COVID here today just because obviously we're living in it, so we probably don't even have all the perspective that we will for years down the line. But and yesterday was 1 year since the first person died from COVID. And as of yesterday, we're over 460,000 people who have died, more than World War II. And it's just kind of amazing. And, you know, today we're talking about the widows, about healing, and about God healing the sick, and God is not limited. And so we really want to bring in to our faith perspective and how in the heck we deal with all this, you know. So I'm a psychologist. I've worked in the field for about 25, 30 years, at Wilder Foundation for a lot of years, and then in private practice at Midwest Center. I work 4 days a week. I deal with intensive care nurses. I deal with teachers. I deal with people out of a job. I deal with people who love being home and don't want to go back. So yeah. So anyway, so it's an interesting time. And so I think it's kind of good to talk about real things in our lives, what's going on, how we deal with daily, and how this affects so many health professionals and our future, really. So the first question that we were talking about was, and you talked about it a little bit overall, but how has COVID really, you know, and this is to the panel at first, and then as we go along, if people want to join in, yeah, if you could let them. Overall, just how has COVID affected your actual job? And then maybe in your personal life, how you've dealt with the juxtaposition of those two things. Esther, Laurel?
Yeah, I can start.
Okay.
I would say that I'm retired, which is helpful in a way. I get to do what I want to do. And as a befriender, I typically visit folk in their homes. Pretty much, yes. And that's sort of up my alley from public health nursing days. And I love it. And I love everything about the Befriended program as well. And so now, of course, I cannot visit anyone in their homes. It's a huge change. And I have to rely pretty much on just the telephone. And so I do, but wow, that is not great, actually, for folks that are stranded in either nursing homes, assisted living, or whatever. Yeah. That's my take on it.
Okay.
Now.
Thank you. Laurel?
Early on, I was let's see, in March, Krister, my husband, was sick with a very bad respiratory issue. My son was in college out east, and we were saying, don't come home because dad's ill. We don't know what's going on. There's no testing. I was ready to round in Region's newborn nursery, and it was like, who's sick? How can we get testing? The day that we could get healthcare relatives or family to be tested, Krista was tested for his illness, but it took 3 weeks. Remember, there were those frozen samples for 3 weeks. We didn't get an answer. So I was trying to go to Regions Hospital to go round on the babies. I had an ill contact. I was saying, stay home from Gabe. So it was just really stressful. We didn't know what we were dealing with. So it was really stressful. Gabe did have COVID. Gabe lost his sense of smell and taste for about 8 weeks. Pretty scary. We didn't realize it, but we tried to look up in the Iranian and English literature, and we found it there. So we've had kind of that experience at work. Things just shut down, and Char will tell you the same thing. We just went from Mach to zero, and then we've slowly added, trying to be careful. Like Char said, every day it was different protocols, different testing. And so we tried to go to video visits. So everybody, that was a thing that came up. And I think video visits are really good if you're doing things like medication refills for anxiety, depression, kids with ADHD, kids that that's good. You can talk about those things. But in peds, you can't really do your physicals and get your shots and stuff online. So that didn't really work for pediatrics. We had to think about how we're going to have people in rooms. Just like we did on the SMART committee here. How do we time things? Everything was in a whirlwind. How do we get PPE? We had to sign out for PPE. It was so precious. I do circumcisions at Regions Hospital. You always used sterile gloves. And for a while they said, if you have your circumcision done in the clinic, we're not going to use surgical, we're just going to use regular gloves. It's like, what? Where are our standards were like crisis mode. Okay.
Yeah.
So big changes there, I think. In my practice, I'm seeing kids, the kids are really suffering, they're at home. I've seen so many kids gain weight. They're eating more, they're less active. They're on the screens incredible amounts of time. It's just epidemic. So, and then we've also seen a lot of anxiety, depression coming out with the kids, and lots of conflict with parents and kids. It's really a hard time. So
Thank you. Char, do you want to put in anything?
Oh, I could probably talk for the next 2 days about how life has changed, both, at home and in the office. And my patients will tell you I will talk for days. But
I love it.
I agree with Laurel. I mean, things have clearly changed in the ways we go about just practicing medicine. It's been a challenge, and I tell my patients all the time, what I'm telling you today is what I know and what I believe. But come back next week, I might give you a completely different story. And I think, probably you all out there can relate to that. I mean, we watch the TV and you kind of start pulling your hair out because you're like, wait a minute. I thought I understood this, and now I have a different perspective. And I think that's been truly difficult to navigate for many people, including health professionals. I actually personally was scheduled to take a week's vacation the week that COVID shut us down. And it was clearly, we kind of saw this coming a little bit, and I had intended to go out of state initially, and I told my friends we're not going. I'm just not really comfortable doing that. And then we were going to go to a cabin up north, and finally it was sort of like there's really nothing we can do. Everything's shutting down. There's nothing we can do. And quite frankly, I felt like I needed to be in the clinic. I spent a week in my clinic twiddling my thumbs. There was nobody to see, but I really needed that information. I needed to get that firsthand information. And things were changing sometimes literally every 15 minutes in terms of what we knew, what we thought. And one of my favorite stories is in those first couple of weeks as we sat and twiddled our thumbs and And literally when we started this in our practice, we see everybody from birth to, 110 years old.
Yeah, I'm sure.
Somebody said, I never knew there were so many people over the age of 90 until I joined the Rice Street Clinic. So we see an incredible, rich, varied age. But in those first couple of weeks, I was sitting there twiddling my thumbs, and anybody that knows me, I don't want to be sitting still. And so I said to my boss, another medical professional, I said, I know how to sew. Like, I have elastic, I have fabric. I could bring my sewing machine in, and I could be sitting in the back room making masks while I'm not seeing patients.
Yeah.
And she said, Char, I think your time's better spent, go home and read a book. We didn't think masks were important. And I said, really? And she's like, don't bother making masks. We don't want them. We don't need them. 2 weeks later, they were like, gosh, we need masks. Where can we get masks? So that's how quickly things have changed.
Right.
It has changed what we look like. I mean, Laurel, I love Laurel's representation. I wish I'd have thought of it myself. A mask, I wear a plastic shield every day. I have worn what I refer to as my pajamas, my scrubs every day to work. It's great. It takes me 10 minutes to get ready in the morning, right? Throw a hat on and all, but it just changes the way we do business. We used to have a lobby full of patients, and particularly with our immigrant population, they come in groups, they come with an interpreter, they come. Now all of our interpreters are over the phone. I have a phone in every exam room and literally hit the buttons as I walk in the room to get an interpreter on the line. And that makes things a little more difficult. It's easy when you can look somebody in the face and kind of talk, but when you've got somebody,
For sure.
The other day I had a Somali gentleman. I had his daughter in the room that he lives with, but doesn't really take care of him. The daughter, who knows his medical history, was on the phone. The interpreter was on the phone, and me, brand new patient, very complicated, and trying to make that happen in between masks and everybody. So that's my life. But things change. If you ask me, things change every day, every week in the clinic.
Okay, thanks. Well, just really quickly, for me, this is where I sit every day doing therapy with people. And of course, you miss face-to-face. Some people are really loving it more, especially people with anxiety and a lot of kinds of things that they don't want to go back, But anyway, sitting here, we don't get out very much because, we take care of my son who's got a lot of immune damage from Lyme disease. So it's been pretty isolating. I haven't seen my grandkids up in Canada for about 14 months. So that has been a difficult part. So.
Yeah, right.
So.
Wow.
I'm going to move on real quick to start about COVID and mental health. And a lot of people, I'll start it off, but a lot of people have mentioned that about that. And I mean, everyone knows how stressful it is. Just a couple of statistics. People respond to stress in many different ways, and it's normal to experience a range of emotions, including fear, anxiety, and grief. But for about 10 to 15%, life will not usually return to normal for mental health issues. Long-term anxiety, mental health impact probably will go beyond the physical impact as far as what a lot of researchers say. In October, 37% of adults said they felt hopeless more than half of the days in the past week. According to SAMHSA, 16.1% of adults received mental health treatment at some point. 47% though still see mental health help as weakness.
Boy.
Men and Midwesterners are the least likely to reach out for help.
I believe it.
There's so many segments of society that are so affected. And we've learned from previous pandemics and national emergencies on on what to do. We know quarantine can lead to, loneliness, depression, insomnia. And depression is such an insidious thing because the more we're socially withdrawn, a lot of times the harder it is to reach out for help. And of course, those who have mental health underlying conditions, like for example, somebody might like obsessive compulsive disorder. A lot of people probably, maybe they wash their hands a little bit more or count a little bit more, but it doesn't come up to the surface until something like this happens. And then it really affects people's lives and functioning, and some people have a hard time going back. But we can talk about this more later. There's positives for a lot of people for mental health too. Some people are really liking the safety, the time at home, feeling safe, the slowing down of life, that whole kind of a thing. So anyway, I'll stop there. Who on the panel maybe first? Would somebody like to give a thought about mental health? Yes, sir.
Yeah. Comes to mind a personal story, and it is so interesting to me that it happened, and so I'll just tell it. I have a dear, dear, dear friend, an old college buddy who lives way up north in Minnesota, and happened to call her. We don't, call each other constantly necessarily, but from time to time, happened to call her at the beginning of the pandemic. Just to kind of check in. And she said, everybody here where I live in this community knows that I am a single woman living alone on this lake and have no siblings. And I am alone and no one has called me. And I said, well, I'll call you every day. And I have.
Oh, wow.
Until the last couple of months when she became a little more involved with her typical church life and, starting with Zooms and all the rest. And also television programs that she enjoyed kind of came back on. And so then now we schedule our visits like every other evening, usually evening. And I'm home alone as well. I simply have a family around me, thankfully. And so I don't have that same sense of loneliness and depression and sort of hopelessness that she was struck with
Right.
at first and continues to have to some extent, but nothing like the beginning.
So
So
socially,
it's that kind of thing, I think, that goes on all the time.
all the time.
That's enough for me.
This is Laurel. I can start. I think it's really hard for new parents. When I'm at Regions Hospital, there's, you can have one person with you, no grandparents, no visitors. And then when you go home, everybody's individually. I've got to give them who's been isolating, an individual plan on who can you see, who's been isolating, who can come over and see the baby, drive-bys, show the baby outside, you can't rejoice in those normal baby
Right.
things.
I bet.
People want to go home at 24 hours and I'm like, stay for the I have to do 2 visits. So I say, stay. There's no reason to hurry up out of here because you've already isolated here. You've been tested, and now you're the ones that have been in the hospital. You're the ones that are contagious actually to your the grandparents and things like that. And then the kid, they're at home with these toddlers and then they're home with these kids, which school is just I just thank my parents. Thank you for doing this hard work. I can't imagine being a parent of toddlers, school age kids, and then the teens. I mentioned that already, the teens and a lot of anxiety. I have a lot of patients who, just like I think Susan said, is that there was this kind of anxiety going on. And I think I had a patient in March who I had said, here's the medication if you want to get started. And they hadn't done it until they started in November when it really came to an end. And then, why didn't I do this before? I feel so much better.
Right.
And the mom was like, she had told me she felt like she had this running commentary all the time. And then the mom was like, that's what I have. And so then she got her treatment. And so it did bring it out a little bit in that way. So,
And some of the brain research that they talk about with what's going on in that part of the brain that handles anxiety, kind of the fight and flight. So all that underlying thing, that, like, I mean, pandemic, riots, political stuff.
Yeah.
It's like trying to keep that a little bit submerged, that your frontal lobes, your executive functioning is really reduced. I can't tell you how many people just keep saying, I'm so foggy. I don't know exactly why, I can't make decisions as well, that kind of thing. And that may be one explanation.
I'm going to jump in here because, in primary care, I will often say most of my visits these days boil down to mental health. They come in with a stomach ache. They come in with, chest pain. They come in with pain. They come in with a million different things. But when you really start knocking down the barriers to talking about that, really, many of these things just come down to I'm lonely, I'm isolated, I have little self-worth, I've lost my job. I'm fond of saying those people who are working don't want to be working because they're nervous about the exposures. And the people who aren't working are nervous because they don't have a paycheck and they can't get what they need. The people that work feel pressured to go to work. I've got to pay my bills. And I say, but you have a household full of COVID. Well, yeah, but I mean, we need to pay our rent. So, they still need to go to work. So, it's no surprise why this disease is spreading. It's no surprise, despite all of our public health efforts to educate communities, particularly, again, back to our immigrant communities. They don't have the resources. They don't have all of the information that is shared in English. They don't have, the technology available to them, and they become even more isolated within their communities. So beyond that, so people become really isolated, and I always look at it as, well, I have a neighbor who's a great introvert. She's a wonderful person, but loves just her own time. And even she's like, I need to see people. Like, this is making me a crazy person. I have a patient who was looking forward to retiring, working from home, pre-pandemic, working from home 4 days a week. Went into the office about once a week, once every 2 weeks, just to catch up on the office gossip, as she would say. Loved it, loved working from home. A year ago, pandemic hits and she works from home now full time. Hates it, doesn't have that ability to be social, to get to her team, look at her team face to face, like she used to, and it destroyed her, and she retired because of that. We're all suffering. This is I mean, people in mental health can back me up on this, but I just feel like we're in the middle of winter. It is, 20 below outside. Nobody wants to go outside anyway. We can't go outside. There's nothing to do. It has been a year of being isolated. People haven't seen their grandkids for a year. People haven't seen their families. People have, we all know the stories.
Yeah.
It's messing with everybody. And I guarantee you 50 to 75% of my visits come down to mental health.
Wow. Right. Yeah. I have heard some positives though, that doctors like you now, that you can go in the back door and offer help a little bit more. Maybe the people might be more accepting. Like if they come in with a stomach ache, maybe they would be a little bit more open now to talk about mental health or to get a referral or something like that. But the other thing too, I think, is that about, well, I can't remember the other thing I was going to talk about. Anyway, the next question talked a lot about issues with family and how to deal with different views about COVID. Anybody want to talk about that, their experience with that?
I'll start. My husband's family, he lives in Sweden. Sweden has a different policy from the US. My in-laws are 84 and 85. And we have been seeing them via FaceTime and telling them to wear masks. My mother-in-law's, oh, we went shopping and they gave me a rose at the flower shop. It's like, were you wearing a mask? No. Or we'll Skype them or FaceTime them, and my father-in-law is out shopping. It's like, where's your mask? Oh, no one wears a mask here. We don't wear masks. And so we've been so worried about them and trying to get the message out to them. My kids gave them masks that say, my grandchildren love me, masks for Christmas, so that they can finally, that the grandkids, at least, we want you to be there when we are able to come visit you. So that's been very difficult day to day.
Wow.
I got my shot, my vaccine. My mother-in-law's like, ooh, and it's like, oh yeah, I'm great, I'm fine. My mother, who's 80, she got her shot. I told my mother-in-law she got her shot. Oh, it's like no side effects. She didn't have any side effects. That's great. So that's been somewhat difficult there with different perspectives on how public health is in different countries.
Oh, for sure. Any other?
I told my mom, who's 82 and has stayed in her house, and I deliver her that she's behaving. I really appreciate it that she stays in.
Love it.
Right. Any other thoughts about this? About family? Hard to talk with family, or?
Susan, we have a question or a comment from Paul. Well, actually, it's from Kirsten, I think. So, yeah, go ahead and open your microphone. It's going to be in the lower left-hand corner, probably.
Okay, that's why
Yeah.
nobody can hear me.
We
I
can-
forgot about that. Yeah, we have family in Vegas and north of Forest Lake, my son and his kids, and they don't wear masks unless they have to. And we have a new grandbaby in the family. And I didn't go there because I was nervous, about COVID and everything, but the other grandma from Texas went there. And so anyway, I set up my flight for this month, but I'm still a little nervous because I haven't got my vaccination. But they have had like tons of visitors. Like Dad and I both have a new grandbaby in October, but I FaceTime him like all the time. He's so cute. And he's so adorable. He'll be 4 months. Yeah. So that's like that age, 4 months. But so Dad's a great grandfather again. He's 91, Dad is. But he got but anyway, nobody like wears a mask, and they invite people over, and I'm like, be safe. And she goes to church, but they've been fine. But Jacob was working on the Strip in Vegas, but he lost his job recently. And I was kind of thankful in a way, but then he got another job at a bar because it's very busy at the smaller bars on the Strip. It's pretty empty now anyway, because they haven't been having conventions and stuff like that. But he's like, Mom, I don't wear a mask in the bar and I'm fine. He just, I don't know. But anyway, I just keep praying. But I'm a little more nervous because I worked with viruses in the past, and I worked in healthcare and activities. So, I'm pretty experienced in knowing about like other things that really spread and stuff like that. But they still don't listen to me. But anyway, Dad got his first vaccination, so he was so happy and so much freer, right, Dad? He feels so much better because we haven't like really had anybody over for we finally had some people over for my birthday for 15 minutes, my family, and then we finally went there for Christmas for a little bit and wore our mask, but Dad's he like seems so much. Where are you, Dad? I can't find you. But anyway, he's probably sleeping through my little speech here. Anyway, I've been struggling myself because of my late boyfriend dying a little over a year ago, and just we were gonna have the funeral like that spring. But of course, COVID, you know, so we haven't even had it.
Oh,
So,
that's hard. That adds to
Yeah,
stress.
to bed, yeah.
so I've been struggling mentally with, well, Dad knows about, yeah, he just said something about me. She hasn't even been to bed yet because I slept all day yesterday. That's kind of my schedule.
Oh,
I tried to reverse it, but yeah, sleep has been my big issue. Do you
Well,
hear that a lot from people about
oh,
the
for
sleep?
sure. Yeah,
Yeah.
for sure. Sleep is a huge thing, and the worse it gets, the worse depression gets. You know, it's hard. But as far as the family thing, I mean, that certainly can add to people's stress and depression and anxiety if you're having people are on different pages. So let me move on to another topic, that the positives. Does anybody really see any positives in their life that on the panel or anybody else that has come out of this? Nope.
I have, but I'm not gonna talk
Yep.
again.
Kent and Linda were waving their hand there. Go ahead and
Okay.
open your mic.
We have the positive of due to the pandemic, our daughter asked us to come down to help our granddaughters with virtual kindergarten. So we're actually seeing them more than we would have if the pandemic had not shown up. But we're also not seeing anybody else either.
Right.
The rest of you.
Right.
And we're also missing a bit of, our weather is different than yours. I'll say that.
Right.
Can be thankful for that.
Anybody else see any positives?
Gary and then Judy.
Yes, I would say a positive for me is having a greater appreciation of Jean. We spend much more time together, and I just enjoy being with her, and so that's a positive for me. When you get time for it, if you would, you on the panel, though, I would like to hear some comments about telemedicine. And how is that helpful? And what are the drawbacks? What are the difficulties, as well as the positives of it?
Let's hear from Judy first, and then we'll throw it back to the panel for that question.
Yeah, I don't. Something that has been on several website or Facebook things that I'm on with people that have MS. And one of the things that people have been talking about is the broader community and the other people who are physically able to just grab your jacket and get up and go when you want to, where you have to think about now where you're going and do you have a mask and, can you go here and whatever. And people that have disabilities, and especially mobility type disabilities, you don't just say, well, I'm going to grab my coat and run out the door and go do something. You have to think about, how much work it is to get ready to go, to get your stuff together, to get in your car and either walk or use some kind of walking device or whatever to get from where your car is to into the place, and just all the ramifications of what you have to think about when you are going to go someplace or do something. And now people who have been able-bodied maybe are getting a little bit of an idea of what it's like to have a lot of impediments in your way, or things you have to think about, or how you have to get ready before you can go do something.
So it might be educating people. Other people are feeling, maybe are learning about this.
Yeah, that's the idea, is that, because some people that are, well, I haven't been going any place just because I don't want to, but there are people who, even before COVID, they were much more homebound and had more difficulty going places, like they don't drive anymore and they have to schedule with Metro Mobility and all that kind of thing. You know, you don't just get up, you think, well, maybe I'll go to the grocery store. Well, if you've got to call Metro Mobility and get it scheduled and whatever. And so it's a lot of work to try to go someplace or do something. And so now maybe, you know, other people will be a little more understanding of what life is like.
Right.
True.
Are there any responses to Gary's question from the panel?
I can get started. Video visits. I think it's been good seeing my teenagers who like to be like this on the screen.
Yeah.
Okay. And so it makes it easier for you to talk to them sometimes. And sometimes they're in their rooms, like their mom say, oh yeah, they answer the phone and they come to them and you can see their bedrooms. It's like, oh, there's a puppy dog. And then you actually see them in their homes. So there's a little bit of that makes it a little bit easier. And I think it's you see them in their homes and you see their paintings on their bedrooms or
Nice.
whatever. So that's nice. Another thing, it's hard to see rashes. You cannot see ear infections. It's hard to see a throat with a flashlight. It's like, you know, there's a lot of, let's try this first. It looks like that. Or sometimes, you know, you can tell, oh, it's, you know, it's a little bit of zoster or it looks like eczema or let's try this with this diaper rash. And so I think there are a lot of things that we can sometimes do with video visits. You know, if there's a urinary tract infection or something, we can talk about it. So there are certain things that it does fit and it works that way. But you can't do a physical. I think in adults, they sometimes can do your physical, your annual, but you're not really listening to your heart. And kids, you got to listen to the heart. You got to check the belly. You got to check, you know, you have to look in those ears.
I think
Char, you had quite a reaction when Gary used the phrase telemedicine. Do you want to share that with us?
Oh shoot! Does the rolling of my eyes show when when I'm off screen?
Sure.
No, I'm going to say even before the pandemic, there was sort of this whole kick toward transformation of how we do medicine. We're all well aware. I mean, medicine costs a lot of money, right? And we all pay for it in some fashion. And even before the pandemic hit, there was some push to try to do more telemedicine. How do we make that happen? And of course, there wasn't really a compelling need or a compelling urge to do that. Go back to the previous question, what changed? I mean, quickly in a week, we were all doing telemedicine in some form. Now, again, I work with a population, many of whom are disadvantaged and technologically, and some of our older population as well is not as keen on things. So I agree with Laurel. The video visits are sometimes really super helpful. I'm old enough to say when I was first in practice and really energetic, I did a lot of home visits and I loved it for just that fact. You saw people in their own environments. I mean, what is primary care? It's like trying to figure out how people manage in their environments, right? And I didn't go to the people's houses to worry about their decorating or that, but if you see, they can't move down the hallway, they have 16 rugs that they're tripping over, you get some sense of how people live and how that makes a difference in their health, right? So I loved home care. So when you can do a video visit, and I agree with Laurel, when you just kind of see the environment with which they operate, it gives you a lot of insight into their health. So there are a lot of things that adapt well to telemedicine. I end up doing more probably phone visits than video visits just because of the technology gap. It becomes even a little bit more difficult through you engage an interpreter, you have a patient and me, and none of us are looking at each other. And so that adds a level of complexity that sometimes you just can't get past. In adult medicine, there's just a lot of chronic diseases that need follow-up, lab follow-up, and you can't do that over the phone. So you talk to them and then you convince them that maybe they can sneak in the front door to the lab, get their blood drawn and be out of your clinic in 5 minutes. I was like the first person to say, please, please let me come back to the office. So I've been back in my office doing face-to-face visits full time since 4th of July, basically. And I would say I didn't go to medical school to talk on the phone. I went to medical school to have a relationship with patients. So I love my office. I love my clinic. I feel safest within those four walls. But on the other hand, my days, I probably have 2 to 5 telemedicine visits every day now. And I kind of look forward to those. It's kind of nice. And there are lots of things that do adapt well. A lot of mental health follow-up. How are you doing on the medicine? Do we need to bump it up? Do we need to do that? People never used to come in for that. You'd say, come back and follow up in 4 weeks. Nobody ever showed up. Now, when I talk to them, I say, you know what, let's talk again in 4 weeks. Here's the date. Here's when you're going to talk to me. We'll do it over the phone. We'll do it in a video. And people do that. So actually you get better follow-up for some of that stuff. So I think it's good and bad. I can't do telemedicine full time. I can't do it. It's just me.
Yeah.
There's lots of things that adapt well. And again, I think the mental health, and Suzan can talk about that, but I think the mental health stuff adapts well.
It does. I wanted to jump ahead a little bit. Dennis brought up something about on the chat about for those of us at 75 and getting our shots, now will our life change? Let's see, how much will our life change from there in the coming months? And I think that is a topic for our church actually too. And if the virus is going to be here in some form for the years to come, so if this is not going to be over this summer and we're not, we don't have to worry about it, how is life going to have to change? How even as a faith community, how is life? How do we need to think maybe about going forward and ministering to each other and that kind of a thing? With all the variants of the vaccines and all that kind of thing. Anyway, anybody want to have some thoughts about that? About, is there going to be a time we're coming back to normal, and how safe will it be once? Well, those are two questions. How safe will it be when we get vaccines?
Hi, it's Laurel. I am the big bummer. Char and I were the big bummers on the SMART team.
Okay.
So here's what it is. So, you get your first shot and it takes about 2 weeks. You're at 50%, just antibodies, right? You want to get up here and you're just like there, right? So it doesn't get up there. You need the second shot to get you the booster so that maybe you get up there, but it takes about, they're saying 7 to 14 days, right? So it takes, if you're getting the shot, the Moderna, it's 4 weeks plus another 2 weeks. So it's 6 weeks after your first shot, people, okay? Before you're even covered, and you might be 90 to 95% covered. Now that still means that you can get it. There's studies where they look at the people, and out of 31 out of the 100,000 got COVID, whereas the people that got the placebo, it was 100. I can't remember the details. You know what I'm saying? 1,000 people versus 31. So people can still get it. So it's not going to change your masking or your carefulness in the first part. It's just that you're not going to get more complications, hopefully. So for me, it was like a big relief. I got that shot. It's like, I'm not going to die from this. Okay. I see 20 patients a day. I've been working with my mask on. I have this kind of feeling, am I going to die from this? Right. So now the anxiety, but it's interesting. We can't just all of a sudden go shopping.
No.
To Rosedale yesterday, I was only there to return something. I'm the one in my family who can go do it. We did something mail in. I could go return it, and that place was crawling with people without masks.
Ooh.
People just hanging around there. I was just appalled. But we still need to keep our masks because we don't know yet. If we get it, do we still have it in our nose, or can we still sneeze it out to other people?
We've got a question about health disparities coming up too, but is there anybody else who wants to speak to this part about vaccines or about when will it be normal again?
This is Dennis. Can I have a follow-up on that?
Yeah.
Okay, we live in a 65 plus apartment unit, a co-op. There are about 90 of us, and we're all obviously older. And I would imagine in not too long a time, we're already at least 20%, more than 20% all vaccinated, and probably within another month or two, we'll be all vaccinated. And we'll have gone through the whole 2 weeks, 4 weeks, et cetera, et cetera. In that environment, with all of us having been vaccinated, will we have more freedom, or will we still, because we keep people that are outsiders, we keep them out pretty good. We're pretty careful.
So that's a big pod. That's a nice big pod you got.
Yeah.
Isolated together. I like your pod. Mhm.
Yeah. So can you imagine that life would be a little bit more comfortable in that setup?
I think a lot of people are doing that in their families. Like kids have their pods, like the kids are home schooled and one parent will be there one day and the next day the kids are at this house and they're with that parent. And the next day it's the other parent so people are doing this pod. So what you're telling me, I hear pod and that you're all isolating together, and that's great. But once one of you guys goes over to Rosedale.
I think that's the problem, right? The problem is the outside influences. People, I can't tell you, every patient I see says, well, I couldn't have COVID because I don't see anyone. Okay, fair enough. Well, when's the last time you left the house? And for some of those people, they haven't left the house for a year. True. But then you say, well, does anybody else live in your house? Well, yeah. Do they go to work? Yeah. There's 3 people in my house that work. Or they go to the grocery store, they go there. And then you start adding all of these outside influences in, and that's where the risk comes, right? So the pods are a great idea. If you can keep isolated in your pod, absolutely, it increases what you can do. But be aware of the outside influence.
Okay.
Saturday Night Live had a skit about people thinking that they were so safe.
Mm-hmm.
Well, and then this is that whole other question too about, is this going to be almost like a lifelong thing as far as trying to figure out our vaccines for the variants? If this is, with all of our worldwide travel and everything like that, how do we live differently almost? Like even in church, we don't want to go around living in fear, and yet, yeah, sometimes it's nicer if it's a black or white. Don't go out at all, or you can go out and be around people some. But how do you know when it is safe to do a little bit more?
Can we maybe just get final thoughts from our panelists on that question, on how do we live hopefully into the future? What are the things that that you would recommend for us individually and maybe for us corporately as a church as we look forward to the coming months here, imagining that gradually more and more people will be vaccinated in our community, and things things are changing on the horizon. School district is doing things differently. People are pointing to next fall with and using the language pretty readily, normal, whatever that means.
Yeah.
And so how do you imagine in your work and for us as a community going forward? Esther, let's start with you and just get your final thoughts as we bring this to a close today.
My thoughts are to move ahead with great caution. I certainly do it myself personally, and I believe that's how we should proceed. And I don't have all the ramifications of that in my head right now, but I say caution. I do say caution. And listen to the experts, listen to science.
Thank you, Esther. Char.
I agree. I think, we haven't spent a lot of time talking about the vaccine, and I know somebody asked about disparities of who's getting the vaccine. I could talk for 3 hours about that as well. But what I do say about the vaccine is right now, everybody wants the vaccine. All my friends call me every day. All my patients call me every day, and they
Yeah.
give me my argument about why I should be first in line. My mom is 97 years old, and she has this and that, and she's going to be first in your clinic to get the vaccine, right? I'm a smoker and I have this, and I need the vaccine. Everybody wants the vaccine. Unfortunately, everybody that wants the vaccine is fighting for that small supply right now. The bigger problem that I see is in 3 to 4 months when everybody has had the vaccine, but that everybody's only going to be about 40 to 50% of the population. We need way more people than that to get the vaccine. And we're going to be on the flip side of this in a few months, begging people to get to those critical numbers where it really does create some herd immunity in the community as a whole. And until we get there, we're going to be doing a lot of things that look really familiar right now. I'm not a doomsdayer. I'm optimistic, but cautiously.
Thanks, Char. Laurel, what are your thoughts?
We're in this together, and we need education, and yeah, it's hard. So to getting the message out there, hopefully we're going to get more vaccine, and it's going to get go faster. But Char's right. The people who want it now, they want it. It's the people that are more hesitant, and we have to say this is a very safe. I wish we had gotten into the details of it, how safe it is, because I've got breastfeeding moms and pregnant pregnant people, women, asking about the vaccine. It's like, yes, it's the technology is, we don't know. At first I was like, we don't know. But now we're getting more information and it's encouraged. So that'll be the big push there too.
Thank you. Suzan, give you the last word today.
Okay. I feel like, listening to all these people today and trying to look at ministry, how do we reach out maybe more to people who are more isolated still, who are having mental health long-term effects? How do we keep some of the good parts of our Zooming? I mean, I think I've gotten to know more people this way, talking to each other, than on a usual Sunday morning. So, looking at it from that perspective for our ministry.
Can I just say one thing is that you guys at church have been so creative. It's just amazing. I mean, think about the positive things of COVID. We didn't talk about that, but the opportunity for creativity that was previously unimaginable. You guys have been amazing.
Exactly.
Thank you, Laurel. That's encouraging to hear for sure. As a congregation, this reality that COVID-19 has put before us, thinking about how to continue being a church in this time, has been a remarkable opportunity to sort of really question everything it is about who we are and what we're about and where we want to put our energy and all of those things. And so my hope is that we'll look back on this time as in part as gift as well, and know that we've learned a tremendous deal, and that's hopefully going to shape our future in some very powerful and positive ways. We hope. We are at the end of our time together, and I want to encourage all of you to put a reaction on your screen or clap for our panelists today. We're so grateful for taking the time, for Char and Laurel and Esther and Suzan. God is definitely at work in you in so many powerful ways, and thank you for helping us as a community learn more and figure out new ways to support you and the work that you're doing, but also to hold you in prayer, and the patients and the families that you see and serve, to recognize that they're a part of our neighborhood as well. And so if there's any way that we can support you in your work, don't hesitate to let us know. The congregation, this COVID reality continues to shape what we're doing, and I'm grateful that both Laurel and Char have served on our SMART team. Their clinical experience has been invaluable to us shaping our protocols, and we continue to try and be as safe as possible. We're starting to do a little more in-person-y stuff, but we're still using many of the same protocol, or we're definitely using the same protocols that we've established that have worked for us so well. Not too far away, we're entering into the Lent in a couple, on the 17th is Ash Wednesday. And then 5 weeks later, we get Easter on April 4th. And that week of Holy Week leading beforehand, we're going to do some more outdoor things. We're hoping that Mother Nature cooperates and gives us a chance to gather again together safely outside. And we're going to do a few things utilizing our facility just a little bit more. And so I just throw that out there as a teaser that we're looking at how to do some things safely in small numbers still at first. But we are hopeful that things will continue moving in that direction. So now one quick teaser for next week. Next week on Sunday, February the 14th, we took our inspiration for our adult forum not from the lectionary, although the Gospel of Luke and the entire scriptural witness speaks of love as its central theme, without a doubt. We are going to look at love from the perspective of a field of discipline called the 5 love languages. And perhaps you have some exposure to this. Every person, I don't care who you are, responds to others and the people that are important in their life. The relationships that are important. Doesn't have to be a romantic relationship. Could be a sibling, could be a parent, could be a child, could be a colleague, could be a neighbor. The way that we communicate with each other, one way to understand that is through these 5 love languages. So this week we're going to send you some resources where you can actually do a quick little quiz if you don't know what your love language is or your primary love languages are. You can take a little online quiz and then you'll know which of these 5 languages speaks the loudest in your life and you respond most positively to. Words of affirmation, physical touch, quality time, acts of service, or gifts. So be thinking about love languages, and next Sunday our conversation will be all about learning what we can learn about these love languages, and it's helpful if you sort of are familiar with what your own proclivities are when it comes to speaking in language of love. And so invite you to join us. Should be a really interesting conversation next Sunday on the 14th. So grateful to be together with all of you this day, and wish you all the best. And whichever team you might be cheering for later today, whether they're a Florida team or a Kansas City team, one of them will win. I can guarantee it. Have a good day, everyone.